Mentoring is such an important responsibility that we all have as nurse educators. We mentor our nursing students because we know they're going to be our future nurse educators. We mentor our nurse educator colleagues, and we even mentor our healthcare partners from time to time. Welcome back, everybody, to Dr. Sellers Educate. We're happy that you're back to continue to support you on your journey to achieve nurse educator excellence. Many of you may be returning because you're on the journey to achieve your CNE. We applaud you for tuning in, hopefully right here on our channel by subscribing. We launch a new snapshot every single week. We want you to stay focused on your journey. Even if you're recertifying, this is a great resource for you to have as well. Now, we want you to bring to your attention two things that you want to make sure that you do every single time you tune in. Number one is to print out the study worksheet. This is going to help you stay focused as you move forward on your journey. The second resource is Dr. Billings and Halstead Teaching in Nursing 6th edition. Now, there is a 7th edition. I actually happen to have a copy right in front of me. It's the 25th anniversary edition, and you can see I'm already starting to tab certain pages because there's so much great information in the 7th edition. However, if you're on the journey to CNE, you want to continue to use the 6th edition. You can see I have lots of tabs here, okay? So 6th edition is what we're using to close our knowledge gaps if you're on the journey to achieve your CNE. There are going to be 2 new CNE exams that will be released in January, and Lynn announced that during the summit. And they also confirmed that they will continue to use, or they did, the 6th edition for the 2 new exam versions. One more plug for the 7th edition, as I was taking a look at it earlier today, is that when you turn on the back, and remember Elsevier, your Elsevier rep, okay, use your resources. They can usually load this textbook for you to the portal, the Evolve portal, so you can access a digital copy. Sometimes they'll give you a complimentary resource, but just check with your Elsevier rep and they can give you guidance. But what we really like about the new edition is on the very back, it talks about changes and updates in the new version. It says that not only is there updated content throughout, which we expected that to align with current evidence-based practices, but listen to this. There are going to be, or there are already, practice questions for nurse educator certification on the Evolve Companion website. Okay, so this is an excellent resource. We know that several of you ask us often where you should find practice questions. We call ours thought-provoking questions because we're not exam writers for NLN. We simply want to stimulate thought as you move forward on your journey. All right, so know that the 7th edition is available for purchase, but check with your Elsevier rep first. And then the second resource, your textbook, that we want to bring to your attention is Dr. Caputi's CNE Review book. Now, we know several nurse educator colleagues have been successful on the exam without using Dr. Caputi's resource. However, for this snapshot, she has the best information to help guide us towards using evidence-based practices when we're mentoring our nurse educator colleagues and our future nurse educators. So let's take a look at our content for this snapshot. Okay, so first I want to just bring to your attention kind of some of the resources that I'll be using today, because remember that we are going over content, but we also want to role model evidence-based practices for you all as well. All right, so right now we're going to use Prezi, and then I'm going to flip back over to Zoom and Poll Everywhere. So we're using 3 different modalities and technologies for our snapshot today. All right, and if you don't have a Poll Everywhere account, it is free, at least the basic version. And that is plenty of options that you'll have available. So I encourage you to use Poll Everywhere to increase engagement. That's what it's all about. We want to increase our students' engagement. We want them to be active learners, active participants in the learning process. And the only way we can do that is by increasing engagement and having conversations with our students about the learning that we are expecting to happen. So you're here today, and I want you to make a decision. I want you to make a decision about what your path is going to be. Are you on the journey towards CNE or recertification? We want you to make sure you're using the evidence-based practices, incorporating those into your classroom so that we can master our competencies as nurse educators. All right, and if you're just tuning in to increase your competence, we're excited that you're back as well. All right, so let's go ahead and take a look at Poll Everywhere. All right, this is going to be, again, a way for us to actively engage our students in the learning process. And if you also are familiar with Slido, that's another resource that you can use. And Mentimeter, many colleagues are now using Mentimeter, and I think that's a wonderful resource also. Like I said, there's several options that you have. You should be able to see my screen. The first thing you want to do when you go to Poll Everywhere is go ahead and activate your poll, and then you can click Present, and it will change to full screen. So let's take a look at this thought-provoking question. Which preclinical activity would best ensure that learners are prepared for client care? We have number 1, completing flashcards for the medications that their assigned client takes. 2, discussing the pathophysiology of the client's diagnosis and 2 interventions. 3, completing a reflection journal entry focused on feelings. Or 4, writing a 5-page paper detailing their client's diagnosis and pathophysiology with references. You will notice at the top that you have actually 3 different options to participate. You can ask participants or your students to click on the QR code, and they can do that with their phone. Or you can copy and paste the hyperlink to take your learners directly to the poll, or they can use the texting system on their phone, and they could text the number 37607 to the Bridget Sale 263 is the actual phone number. Okay, so we want to give students options. And then, of course, if they're not able to participate because they don't have technology available, you can also ask them to write their choice down on a piece of paper. You can collect those and you can vote on behalf of your students. But again, we want to increase engagement so that our students understand the importance of active learning. Okay, so if you chose number 2, you are correct, discussing the pathophysiology of the client's diagnoses and 2 interventions. The reason why this is going to be the best option is because we want to engage our learners using a holistic approach for preclinical activity. Okay, so yes, we want them, or it would be a good practice for them to complete flashcards about medications, but that's only one task associated with patient care. Completing a reflection journal, well, that usually happens post clinical activity, right? That allows students to kind of think about what learning happened, aligning their decision-making processes with the evidence-based practices. And then with the 5-page paper, we want to maximize the time that students have at the bedside. Remember, the purpose of clinical experiences is for students to engage in those hands-on patient care decision-making processes as much as we can and as often as we can with our students. When we think about bridging theory to practice, we want to go ahead and introduce that even in our classroom setting through unfolding case studies. That's just one example, but we could do role playing as well in the classroom. And so now we're going to go back to Prezi, and let's take a look at some additional content that we want to share. So this is just an example of what collaboration and active learning would look like. I want you to jot down some examples of active learning that you see occurring in this picture. All right, so you can just take a few seconds to do that. You can do that on your study worksheet. Remember that also at least 70%, 70 to 80%, depending on which version of the exam that you get, is going to be about application and analysis. Okay, so this is why we want to engage you all in more activities that are going to hopefully trigger a thought when you sit in front of the computer to take the CNE exam, or CNE novice or CNE clinical. We want there to be a thought that's triggered that allows you to reflect on your firsthand experiences or the study content that you have used along the way on your journey. Okay, so we want you to think about what active learning do you see, what interaction do you see happening, and what strategies can you bring into your classroom, perhaps that you see here in this picture. 55%, we shared this in our last snapshot, of respondents in this Becker's health review research shared that there's a lack of residency program, strong nurse residency program in their institution. We also see reported in this update that at Novant Health, they reported 85% retention of their nurses and they contributed to, one of the contributing factors was having a strong residency program. When we think about residency, we often think about the nurse at the bedside. However, there's huge value to even considering that at our university level. We know that there's increased turnover in the academic setting. So what we want to do is consider what a mentoring program would look like, what true onboarding looks like with our nurse educator colleagues. We know that even when we finish our MSN in nursing education, we still have some missing pieces. Our practicums are great experiences. The majority of the time, that's what I teach at the graduate level, is in the practicum or in the theory courses. So we know there's still a gap that our nurse educator colleagues have once they graduate. All right, so we're going to continue to explore in this snapshot our second, because our last snapshot focused on the number one strategy and responsibility that we have in our nurse educator role. And of course, for all of you that love curriculum out there, you know that's where we started. But now we want to take a deeper look and looking at number two when we think about bridging theory to practice, and that is the mentoring process. What strategies should we use, and what are evidence-based practices related to mentoring? The first resource I want to bring to your attention is the Billings and Halstead 7th edition. You can find resources there, which I was excited to see, about mentoring on pages 17 and 611. In the current 6th edition, there isn't a lot of content. In fact, there's no content at all that specifically targets the role of mentorship as a nurse educator colleague. There's information about the mentoring process for our diverse learner, but specifically in this snapshot, we want to focus on what strategies you should use to support the mentoring process at your university with nurse educator colleagues. And then Dr. Caputi on pages 107 and 108 describe a solid mentoring toolkit. So what should that include? Well, first, it's about matching, right? Aligning the mentor with the mentee to make sure that it's a good fit. Also, NLN has provided resources in 2008 and 2018 about mentoring being one of the key contributors in the faculty career development process to support a healthy work environment. Okay, so you can see on box 5.4 in Dr. Caputi on page 108, it talks about what these tools and mentoring should look like, specifically behaviors, which include the active listening, affirming and challenging, giving feedback to our colleagues, especially when it comes to classroom observations, what did we observe that was positive, and what are those opportunities for improvement? All right, so you want to think about what strategies you currently use at your institution and what adjustments you want to make to your mentoring program. Next, we want to take a look at some additional content as we wrap up our time together today. The second role that we're talking about in this snapshot is leadership and mentorship. Okay, so this is the second role and competency that we want to focus on. When you take a look at our CNE competencies, it is listed under the quality improvement behaviors, being able to partner and collaborate with our nurse educator colleagues to make sure that they have the training that they need, okay? And then also our nursing students, we have an expectation that we should mentor them, give them feedback continuously through formative feedback that will allow them to make adjustments in their patient care decisions, or perhaps adjustments in how they study so they can perform better in the classroom. And then our healthcare partners, as we mentioned earlier, we also want to take a mentorship opportunity with them. Oftentimes, they do not have a lot of experience in the academic setting, and they can bring a lot of perspective into our conversations about what our curriculum should look like, and even perhaps what onboarding should look like, how it should look differently for our clinical faculty, as an example. So we want to provide this continuous feedback to our colleagues and to our nursing students in hopes that they will increase their knowledge and skills on their journey towards achieving success. This episode has been helpful. Feel free to reach out to us if you have any questions. Info at Dr. Sellers Educate. You will be successful on the CNE exam, just as Dr. Miles was. She shared with us during her recent success on the exam that she felt like she had all of the resources that she needed as we supported her on her journey. identifying target areas that you want to focus on to help ensure you're closing your knowledge gap is a key step in the process. We hope that this episode has been helpful, and we will see you next time. Have a great one, everybody.